Hello, my name is Emma, and today for Mental Illness Awareness Week, we're kind of shifting focus a little bit, and we are going to be talking about diversity and representation of mental illness in YA literature. The topic of discussion for this video came to me about 6 months ago when I had posted a tweet observing how in a lot of big, massive YA sequels, the main protagonist is suffering greatly from the effects of the first book, which kind of results in this theme of the miserable protagonist, which I have personally come to find very repetitive and unpleasant to read. And I am not saying that to diminish what the character has gone through or like establish criteria for being emotionally damaged or anything of that sort. It's just this cycle of a traumatic event at the end of the first book. The first half of the second book, the protagonist is miserable and broken, but they're able to pick themselves up in like a split second and then everything is fine for the rest of the sequel. That trope has just become very repetitive and I just don't like it. It's not unpleasant to read because the main character is depressed because it's something I love reading about. It's just that I'm sick of reading the same course of events over and over and over again. On that thread of tweets, I got a lot of positive feedback from a lot of people agreeing with me, especially in that particular instance. But I did have one person disagree with me who said they enjoyed this trope of the miserable protagonist because it was someone they could relate to. So this discussion had formed off of two realizations at the end of that tweet thread. Number one, it reinforced my belief that representation is relative and not objective or absolute. And number two, it made me realize that we are so lacking in diversity of stories in mental illness books. The bulk of this video is focused on point two, but as for point one, when talking about diversity as a whole, it is extremely difficult to assign one absolute authority that determines what is right and what is wrong, and what is accurate and what is inaccurate. I'd like to think that I've surrounded myself with a group of readers that are empathetic enough to understand that while some stories may not represent all, they do represent others, and vice versa. I think a great example of this is personally All the Right Places. This is a book that I really did not love. It kind of went against all of my 9 years of experience with mental illness and my past 5 years of studying psychology, but that does not exclude the massive amount of people that have really identified with this story and it's given them comfort, and I think that's a great thing. So when talking about diversity and diversity in mental illness, I always have to remind myself that what might not be accurate for me is definitely going to be accurate for others. Now, while this whole conversation of what is good representation can get pretty murky, I feel like some of it might have to do with the fact that in literature concerning mental illness, we are exposed to these same stories over and over, and a lot of the stories that don't normally get recognition are just falling further and further into the sidelines. That is why we need diversity of mental illness in YA. Now, as somebody who has a lot of experience with mental illness and is studying to be a clinical mental health counselor, for me, it's very easy for me to look at a book and find an author who has really tried very hard to create a true and accurate character and somebody who just Googled the symptoms of something like bipolar disorder and decided to base a story off of it. This is where we get into the concept of personified illness, where the character doesn't represent anything other than the DSM-V definition of the disorder, which is a big problem. It's pretty easy to write a book about mental illness. What's not easy is creating an authentic character that is more than their diagnosis. Another problem I have with this is by following the same generic progression of the disorders, you are excluding a ton of voices that might be suffering from the same illness but are not a textbook case. I think the best way I can describe this is I have read a ton of books on mental illness, but I have not been able to identify with a character in my present mindset since high school, and I graduated high school almost 3 years ago. And I've read a lot of books about mental illness in those past 3 years. It is so easy for me to say, wow, this is how 15-year-old anorexic Emma felt. Which is great for 15-year-old anorexic Emma, and you know, even now, it's still great for me to be able to read a book and relate to a past mindset, but I have yet to say, this is how 20-year-old eating disordered Emma feels right now. I have yet to find a character who has been in recovery for years, or has been on medication but weaned themselves off of it, or is trying to prevent themselves from relapsing or actually relapsing some of the time. Currently, I have not found somebody in my position, a position I can promise you a lot of people are in, and that is a really terrible and disappointing thing. That fact sometimes reinforces already present or occasional thoughts that I'm alienated from my disorder, like I'm not the right kind of anorexic, which is the absolute opposite of what you look for when reading a book about mental illness. By telling the same story of somebody who develops the disorder in the beginning, following that development for a couple of months, but ending the story right as they begin to come to terms with it or enter recovery, you are eliminating a wide variety of people that are in so many different stages of their illness, which I think actually take up the majority since everybody's story is so different. I also think when writing, a lot of YA authors specifically gravitate towards disorders like anxiety and depression and eating disorders that are more romanticized in the media, whereas things like psychotic disorders and personality disorders get way less attention, and when they do, they're normally designated to undesirable characters, which just reinforces stereotypes. Think of the ratio of protagonists to villains with narcissistic personality disorder. That is like 1 to 10,000. Give me a main character who's a sociopath to prove they're still normal functioning human beings. Stop reinforcing reinforcing that all bipolar individuals are moody, or that all schizotypal persons are weird, or that all psychopaths are murderers. Because they're not. When you only designate certain archetypes of characters to a particular disorder, like the suicidal main character falls in love, but the histrionic antagonist deserved their death, you are further creating a stigma within the already present stigma of mental illness. A big part of tackling diversity is giving voice to the populations that are normally undermined by society. By doing this, you can inform others of what it's like to have a mental illness, and even disprove some of those disgusting stereotypes that people love to reinforce. But what I feel is most important about that is you're able to offer others in a similar situation comfort, someone to relate to, someone to identify with. But on the other hand, if the only representations we get of narcissism are characters like Lord Voldemort, that person doesn't really have anyone to identify with at all, do they? Another thing that I feel also stunts the growth of diversity is how reliant mental illness stories are on romance in young adult literature. If you've been watching my channel, you know that I am a romance lover, so I am spewing some real shit here. Now, when I survived my first wave of anorexia when I was 14, I didn't have a boyfriend. I only had my friends and family to help push me into recovery. So it really gets under my skin when a lot of these books being published about mental illness end with a love story rather than ending with the development and the progression of this person's disorder and recovery. It gets to the point where a lot of the times I feel like disorders like anxiety and depression are actually being exploited to produce a good, deep love story. Let me be clear that my illness is not here for your entertainment, and I refuse to let my struggles be used as a plot device to propel a romantic interest. I think the excessive inclusion of romance in mental illness novels, and the keyword there is excessive because there are so many powerful love stories about individuals suffering from mental illness that absolutely deserve their spotlight, and I'm not trying to diminish them whatsoever. But the ones that are reliant on romance are what needs to stop, and we need to step away from mental illness romance novels and focus solely on mental illness novels. Related to the topic of romance, I also think it sometimes replaces a lot more important aspects of mental illness, which is so problematic. What I find to be a recurring theme in mental illness novels is the impressive lack of professional help and medication. Now, I've personally been in and out of therapy since I was like 6 years old, but my official recovery for anorexia started at 15. Over those 5 years, I've spent time with a nutritionist, a social worker, and a psychiatrist. Although I'd like to think that my eating disorder is currently under control, I still go to bi-weekly sessions with that social worker I started with 5 years ago when I first entered recovery. Especially if you're a minor, which I would say all of these young adult books follow, probably about 80% of the time, at least, if you're diagnosed with a mental disorder, you have to partake in some kind of clinical therapy. Thinking back on the mental illness books that I have read, I would say less than half of them focus on some kind of clinical therapy. Not only does it seem a little unrealistic to me, the lack of attention things like therapy get in books could potentially warp the already messy idea society has of clinical work, but by not even addressing the option of professional help, some suicidal teen might be fearful of entering therapy. They might think it doesn't work, or they might reject treatment. When in reality, reading about a character who is in a similar situation to you but responding well to counseling might actually push them to join treatment. Medication is also seriously misrepresented in YA. Now, I am personally someone who has experienced the good and the bad of pharmaceutical therapy. Long story short, that I will discuss later in the week that's more fleshed out, I went on to antidepressants, which did help with my depression, but I did develop schizophreniform from the drugs. They fixed my dosage, and I haven't had a relapse of my psychosis in 4 years. So I've probably experienced the best of the best and the worst of the worst when it comes to medication, but I'm somebody who would truly recommend it to anyone, even with all of that. I have met some people that are super against using medication in treatment for mental illness, and that's totally fine, but I think when you're presenting the option of treatment, it's something that should be addressed and people should know is there to try. The problem is prescription drugs for mental illness in young adults is either totally dismissed and not discussed at all, or is this kind of demonification of medication that is super harmful. There are certain disorders that, when paired with traditional therapy, medication can really help, like anxiety and depression, and I can tell you from experience, this is a really great asset some of the time. But unfortunately, there are other disorders where research is really limited, and pharmacotherapy might be the only option in treating things like schizophrenia. Medication is just something that needs to be talked about when talking about mental illness. We need to see the good and the bad and the ugly of all of these different stories, but in my opinion, we only see the bad And that really needs to change. Now, I'm not saying that clinical therapy and drug therapy are the only options for mental illness, because that's not the case. But by excluding them completely or misrepresenting them, you're creating very harmful stigmas against things that could potentially be very helpful to your target audience. Now, I'm not an author and I don't claim to know how writing works, but if you're writing a book about mental illness and you're not writing it for people who have suffered from mental illness and are looking for someone to identify with, or writing for people who are looking for better information and new ways to learn about mental illness, who are you really writing for? I think that really concludes all of my thoughts on mental illness, diversity, and representation in young adult literature. What I hope you take away from this discussion is, firstly, representation is relative. What does or does not apply to you is not the same for everyone, and that's why the topic of diversity is important to literature in general. On a deeper level, we cannot stop at inclusion. We need to make sure that within that incorporation, we have a widespread execution that does cater to all with the variety of stories that we are seeing. Personified illness is a thing that needs to stop, point blank. We need a wider spread of stories within a disorder being told, because authors tend to follow the same progression of an illness, and like I said, not everybody's story is the same. We need to stop highlighting certain disorders and neglecting others. The excessive use of romance and mental illness novels can actually sometimes take away from the disorder, which is a big problem. And there needs to be more professional help included in these books. This is a topic I am extremely passionate about, and I would love to keep the discussion going, so please feel free to leave your thoughts on mental illness in books below. What do we need more of? What do we need less of? What's being done right and what's being done wrong? And of course, don't forget to enter my giant mental illness international book giveaway. All of the guidelines and instructions for the giveaway are in the description of this video. But that is it. Thank you guys so much for watching, and I will see you tomorrow for a new video. Bye!